A pediatric vaccine could be here sometime next week. There are many parents who have questions and many are unsure about whether this is even necessary.
So we're asking the doctor to weigh in. Dr. Richard Kang is the medical director of the pediatric ICU at Dignity Health Northridge Hospital. He's with us now. Dr. Kang, thanks so much for being here this morning.
Thank you.
Morning.
Well, a recent survey showed that only 34% of parents with kids ages 5 to 11 said that they would get their kids vaccinated as soon as possible. Now, as someone who oversees the pediatric ICU, what would you say to parents who are hesitant to get the kids vaccinated because, first of all, they don't think that COVID poses a serious threat to children, and then they're fearful that the vaccine may harm their children?
So, yeah, although kids are less likely to get sick with COVID, in this age group of kids 5 to 11 years old, there have been about over 8,000 kids hospitalized, and of those, about 100 deaths. So not an insignificant number. But in terms of the hesitancy as well, the literature shows that it's been pretty safe, efficacious, and the vaccine will protect their child against COVID, as well as others around them.
I think for a lot of the parents we talked to, the concern is this is a brand new vaccine and what long-term side effects could develop down the road. Can doctors and scientists guarantee that there are no long-term side effects down the road for our kids?
Yeah, I guess pediatricians are important because they have a good relationship with parents. And in terms of the study, the reason the data took so long was because they wanted to wait at least 6 months after vaccine administration to see if there were any long-term side effects, and there really weren't. It was a very safe vaccine, and again, efficacious in terms of providing protection for the child.
I think for the parents, the long term means, okay, my kid might be 8 now, but when they're 16, with mRNA type technology, is that going to change anything down the road?
Yeah, again, the data doesn't seem to show that. We don't know, obviously, in terms of that far ahead. But again, we also don't know the long-term effects if your child does get COVID. And again, this vaccine will protect against that as well.
Well, what kind of role do you think that pediatricians are going to play in this vaccine rollout? Or will parents need to take their children to the big vaccine distribution centers?
So there'll be various places that you can't get the vaccine. Obviously, your pediatrician is one of the options. They will be provided with vaccine doses as well. And again, I think that's one of the places where you can get information, reassurance about the vaccine, as well as other places that are available now, such as pharmacies and distribution centers.
Also, a lot of parents are going to be heading out trick-or-treating this weekend. It's a big, we've talked to a lot of them. This is a lot more people expected to get out compared to last year when we were kind of getting into that lockdown mode. Any advice you have for them this weekend?
So again, it should be fairly safe if you're outdoors wearing a mask. I would still recommend against having large indoor gatherings as there's still a risk of spreading the virus in those settings. But again, if you're outside trick-or-treating, wearing a mask, it should be fairly safe.
And you're talking about wear an actual COVID mask underneath your Halloween mask, right?
Yes,
okay.
yes,
Okay.
Right.
Dr. Kang, thank you so much. Dr. Kang with Dignity Health, you have a great day, sir.
Thank you.
All right, thank you.
Also, this